Again, my name is Ben Gross, and we implemented at Sheba a system developed by MilagroAI, and we're going to present the system as it was implemented at Sheba. This is very frustrating. Okay, so first, some terminology. Hospital-acquired infections are of 4 types that we wanted to survey at the hospital. Central line-associated bloodstream infections called CLABSI, ventilator-associated pneumonia, VAP, surgical site infections, SSI, and catheter-associated urinary tract infections, CAUTI. The Israeli Ministry of Health requires surveillance of CLABSI in all ICUs of the hospital, and surveillance of CAUTI only 16.6% of admitted patients, but across all departments in the hospital. The Joint Commission that Gadi discussed, we're due for an audit in a few months in June. They require surveillance of all 4 hospital-acquired infections for all admitted patients across the hospital. Now, doing that kind of surveillance manually would require 50 additional nurses, which we just don't have, and that's where MilagroAI comes in with their automatic process. So in general, for data to be actionable, they need to be analyzed in real time. More than 70% of relevant information, as many have mentioned before, is locked in unstructured data in history and physicals, radiology reports, operative reports, and nursing flow sheets. Most of the structured data is episodic, noisy, sparse, and irregular, and the clinical events that define what is a hospital-acquired infection of those 4 categories can be very complicated. And here's one example of one such algorithm for ventilator-associated pneumonia. Each one of these is a data element, and all the connections between them, you need at least one of these over this many days, and we divide here between the unstructured data and the structured data. The unstructured is yellow, and structured is blue. So it's a very complicated algorithm. The data required for these varies. The number of data elements varies between the different algorithms. For instance, CAUTI is relatively simple. It only needs 51 data elements, but that's also quite complicated when you consider all of the temporal relationships that need to be tested between them. And again, you can see the distribution of textual data, structural data, and calculations. And here, just to give an example, one piece of knowing in that very complicated algorithm to detect central line associated bloodstream infection is to know how long the central line has been in place. But if you rely only on texts from the follow-ups, you might determine that there was a central line in place for 2 days here, and then it was taken out, and then 2 days here, because that's what the data says. If you rely on the EHRs, in our case it's Chameleon and MetaVision, you might see structured data showing that the central line was in place for 3 days. But you have to combine all data sources to realize that this patient actually had one central line, not twice, and it lasted for 5 days. So MilagroAI offers 4 engines to achieve what they do. The first is a text analytic engine, which automatically extracts complex clinical concepts from the unstructured data. The next is a reasoning engine that transforms the episodic, noisy, sparse, and irregular data into temporally meaningful medical concepts. The third is the algorithm engine that automates in real time published complex algorithms like those CDC guidelines that I showed you before. And finally, an AI engine that creates and processes in real time new AI predictive algorithms. When the next slide comes up, I'll talk about a um, results of a study that we did at Chiba. First of all 4 of the hospital-acquired infections are being surveyed across the ICUs, but we've done validation of the CLABSI infection. And so the real-time classification is done based on the CDC published guidelines. It used structured and unstructured EHR data of close to 4,000 ICU stays over a 12-month period. The infection control specialist manually reviewed the records in this validation process and detected 288 patients with CLABSI, and MilagroAI had identified 100% of those cases. In conclusion, the next steps for the company and their product is to proactively reduce hospital-acquired infections by using real-time predictive analytics and also early detection. So if we can predict it and we can detect it early, then we can also do something about it. And that's it. If there are any questions, Amit or I can answer. All right. Thank you very much. Thank you for the entire session. Thanks to all the speakers.